Ulcer is defined as a deep loss of the skin extending into the dermis or deeper. Eventually, it will result into scarring. General examination of the ulcer should be performed first before we narrow it down into a diabetic foot ulcer examination. This is because diabetic foot ulcer is very common in orthopedic. Prior to the physical examination, wash hands first, then introduce yourself to the patient. Gain the patient's consent.
Good morning, Miss and Liana. My name is Lim Ji Yun, Year 4 medical student. Today, I would like to examine your leg and foot. Are you okay with that?
Okay.
Thank you.
First, start with the general inspection of the patient.
Okay, the patient is supplied comfortably, no in respiratory distress, no in pains, and has a normal body view.
Expose the patient from thigh to feet. Then, proceed to the inspection of the lower limbs. The common sites of ulceration at lower limbs are sacral, greater trochanter, ankle, and foot. If the ulcer is at the medial side of the leg, then it is a varicose ulcer. If it is located at the lateral part of the leg, then it is an arterial ulcer. Don't forget to also check the lateral malleolus, heel, and dorsal aspect of the toes. For the cubitus ulcer or pressure ulcer, the expected site is at the heel. Apart from the ulcer in diabetic foot, also look for amputation, trophic changes of the skin like dry, shiny skin or loss of hair, and deformity like Charcot's foot, claw toes, and hammer toes. For ulcer examination, remember to wear gloves.
There is a single ulcer is seen at the sore part under the first metatarsal bone. The shape is round with the size of 2 × 2 cm with the well-defined margin and palm out edge. No discharge is seen. The surrounding of skin is normal and there is no poor hygiene of sore.
After that, we'll proceed to palpation. Before palpating the skin, ask whether there is pain at the site that you want to examine. Do not start with the pain site first.
Do you have pain on your leg and your foot?
No.
Thank you. The temperature is normal and there is no tenderness. There is no tenderness on the surrounding of the ulcer. The edges is in the soft inconsistency. The base is in the soft inconsistency and there is no bleeding or discharge is found. The ulcer is freely mobile in the 2 perpendicular plane.
Next, we'll proceed to vascular examination.
The dorsal pulse is normal in both sides of the leg. The posterior tibial artery pulses is normal in the both sides of the leg.
If both of them are not present, popliteal artery and femoral artery should be taken. If absent, perform ankle brachial systolic index assessment ABSI. Now, we will proceed to neurological examination. Then, we'll check for ankle reflex.
The ankle reflex is normal on the both legs.
Now, we'll assess for touch sensation.
Miss, this is a cotton. I will put it here. this is soft. Then I will put it on your leg and your foot. If you feel soft, please let me know. Say yes. And please close your eyes.
Yes. Yes.
Is it both sides same?
Same. Yes. Yes.
Is it both sides same?
Same. Yes. Yes.
Is it both sides same?
Same.
Thank you.
Now, we'll assess for pain sensation.
Miss, this one is a prick sensation. Then I will also same, I will put it on your leg and your foot. If you feel it, please say yes. Now close your eyes again.
Yes. Yes.
Is it both sides same?
Yes. Yes. Yes.
Is it both sides same?
Yes. Yes. Yes.
Is it both sides same?
Same.
Thank you.
Next, we'll test for vibration using 128 Hz tuning fork.
Miss, this is the vibration sensation. Do you feel it?
Yes.
Okay. Then I will put it on your foot. If you feel it, if the vibration is stopped, please tell me.
No more vibration. No more vibration.
The vibration sensation is intact.
If it is still vibrating, the patient has impaired vibration sense. If the patient feels no vibration, she has absent vibration sense and thus peripheral neuropathy. After that, we'll do monofilament testing for pressure sensation.
I now will put it on your hand and feel it.
Yes.
And please close your eyes.
Yes. 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 Yes.
In this video, the amount of pressure applied by the examiner is actually incorrect. It should be done like this. Apart from the 4 important spots shown, there are still 5 other spots as shown in this picture.
Thank you, Miss Emiliana. To complete my examinations, I would like to do some investigation which include the random blood glucose, random profile, and the ECG, blood pressure, as well as the fundoscopic examination.